30% of women in their reproductive years may experience uterine fibroid tumors, which are generally benign but still need to be treated. Dr. Joseph Constantarakis of Mission Hospital in Mission Viejo discusses what uterine fibroid embolization does to help treat this condition.
Uterine fibroids are benign or non-cancerous tumors of the uterus. And uterine fibroids are the most common tumor type of the female reproductive tract. Fibroids are very common. It's thought that up to 30% of women of reproductive age have fibroids. It does tend to run in families, so if a relative, an aunt or a mother has fibroids, then you're probably at a higher risk of having these tumors. A vast majority of them are non-symptomatic, but they can be symptomatic and cause problems. Some of the common presenting symptoms in women with fibroids are lumped into two categories. Bulk-related symptoms, or symptoms related to the mass effect of the fibroids, and those symptoms can include pain in the lower abdomen and pelvis, in the back, constipation when the fibroids press on the rectum or the colon, urinary problems when the fibroids are pressing on the urinary tract. One of the other categories of symptoms is heavy menstrual bleeding, and that's certainly one of the common presenting symptoms in women with fibroids. Initially, when women present with fibroids, often a conservative approach is opted first. That includes a regimen of birth control pills, sometimes other forms of hormonal therapies, and non-steroidal anti-inflammatory medications. In many women, this is a viable option, and it does a good job at reducing their symptoms. If those medications don't work, then surgical options include hysterectomy, myomectomy, which is a surgical procedure whereby the uterus is left in place but the fibroids are removed, and the fibroid embolization, which is a procedure that interventional radiologists such as myself do. The procedure of fibroid embolization is actually a fairly straightforward and simple procedure. It takes in general less than an hour. Patients are home generally the next day. Our literature shows that between 75 to 90% of patients will experience rather significant pain relief or bulk symptoms related relief with this procedure. The success rate for women who present with bleeding fibroids is actually a little higher, on the order of 90 to 95%. So it's a very successful procedure. Approximately 80% of women will be good candidates for the fibroid embolization. Patients who would not be a good candidate would be a patient who is interested in preserving their fertility. Over the last decade, fibroid embolization has emerged as a very successful, very popular form of treatment for fibroids that is much less invasive. Women are back to their normal activities much sooner than those that opt for the surgical approaches.